Hey everybody, this is Peter Beerhouse. I'm still at the Academy Health meeting in Seattle, and I'm walking down the hall, and who do I run into? Our colleague Ed Salsberg. And as many of you know, Ed recently published in Health Affairs a blog looking at the nursing workforce, showing us a lot of data, raising a lot of interesting questions. And so I asked Ed, would you take a few minutes and walk us through what you found with this blog? And so, Ed, thanks very much for taking some time. It's a busy day, and so let me get right into it and say, what motivated you to sort of write this blog? What was the purpose behind that?
Well, I try and track changes in the number of graduates in nurse practitioner programs and RN programs because it has such an important impact on both the supply, overall supply, and also our ability to provide services, needed services to the community. And so I've been tracking RN graduates using National Council and State Boards of Nursing data and tracking NP graduates using the American Association of AACN, the American Association of Colleges of Nursing data. They put out, both organizations put out really helpful data, and so I review and monitor their data periodically. And this year I was taken aback when I looked at the results of in both sources of data. In particularly interest was the AACN data on the number of nurse practitioner graduates. Somewhat amazing, really impressive is the fact that in just 10 years ago, we graduated about 8,000 new NPs. And now this year—
Did you say 8,000?
8,000. And now in 2017, there were about 28,000.
Wow.
More than, double-digit growth for 10 years in a row. And that really has major implications for the healthcare delivery system. Among the major implications are that it means that NPs can be providing more and more services to our population. They've been playing an increasing role, and I expect this to continue in the future, and these numbers make this possible. It also means that the relationship between nurse practitioners and physicians may be changing, because with 28,000, that's almost as many new physicians as we produce each year. We produce about 32,000 new physicians each year, and if nurse practitioners continue growing at this rate, then in 2 or 3 years, we'll actually be producing more NPs each year than we are producing physicians. Another interesting implication of this is if 28,000 or more RNs are becoming NPs, that means there's going to be fewer RNs available to provide registered nursing services. And it raises some concern in my mind whether we're not going to have an adequate supply of RNs because so many RNs are moving out of the RN role into the NP role. So I think there are a lot of implications of the new data that are worthy of consideration in the policy community. I will tell you, I also have some concerns at the rapid growth of NPs, whether we have the danger of overproducing. When you go from 8,000 to 28,000 in 1 decade to meet a short-term need, which is a real short-term need for more services, but there's always the danger that by tripling or quadrupling the number that you will, 5 or 10 years down the road, have more than you need. So we need to, I think, monitor this growth on a regular basis and see what's happening in terms of new NPs in the marketplace.
Wow. Ed, thank you so much. You hit all the main points that were, I think, on my mind and probably on the mind of many of our viewers. So I appreciate it. Have a good
Peter,
rest of the meeting.
One last point I
You
want to
got
make.
it.
I'm sorry. The rapid growth of NPs also has implications for how many physicians we're going to need.
Oh, good point.
Because there's been a lot of policy discussion about whether we should increase the number of residency slots in order to increase the supply of physicians. Well, if we're producing 28,000 new NPs per year, they're going to be providing many of the similar services as physicians, and I think it should really allay the fears of people about a potential shortage of physicians. So nurse practitioners are going to be a critical part of the delivery system going forward.
Great.
Thank you, Peter.
Ed, thanks so much, and appreciate your taking the time. Enjoy the rest of the conference, and we'll catch you next time.
Thank you, Peter.
Bye-bye.